Have you ever had some kind of medical problem and you went to the doctor and the doctor went ahead and prescribed you a prescription? Have you ever thought that maybe there's a different way of doing this? That maybe this isn't what you want, what's best for you? A lot of people don't think about this. And this is one of the many reasons why I'm here speaking with you today. America is over-medicated. And there's three factors that I want to talk to you about today. And one of them is just the plain numbers. How many more prescriptions we're writing, those kind of things like that. And then the crisis that we're in, as far as the opioid crisis, and then also ADHD over prescribing medicines for ADHD. So to start with, let's look at the numbers. ConsumerReports.org has an article called Too Many Meds, America's Love Affair with Prescription Medicine. And they found that prescriptions have increased 85% since 1996. That might seem like a lot, and you might say, hey, well, what about population growth? Well, population growth was only 21% in that same time frame. So we're prescribing a lot more prescription medications than we were before. This might not seem like a problem because we're coming out with better medicines and stuff like that, but it's really has some negative factors. Just like a lot of people have multiple healthcare providers. So 53% of people who get prescriptions have multiple healthcare providers that are prescribing them medications. And the problem with this is sometimes doctors don't talk to each other. In fact, often they don't talk to each other. So when they prescribe a medicine, it might conflict with another medicine. And there's been cases in the past where that's been happening. But that's not something that has contributed to our issues at large right now, like epidemics. And one of the biggest issues that we have is the opioid epidemic, or opioid epidemic. So the U.S. Health Department and Human Services, their article, Understanding the Opioid Epidemic, in 2016, 116 people die a day from an overdose. This is one statistic that they have on their website about the opioid epidemic. This epidemic is reached all parts of America, and another interesting statistic from them is 11.5 million people misuse opioids. This problem has even reached so far that it's been talked about by the president. In fact, it was talked about in the State of the Union address and how they want to combat the opioid epidemic. This problem is systemic into our culture and our environment. People are losing family members, they're losing parents, they're losing kids to this because opioids are the same as heroin. And so we all know that heroin is very addictive and it's very bad for users. It's very easy to overdose on. So we've created this environment with our overprescriptions that now we have people dying from it. But this isn't the only crisis. In fact, ADHD medications pose similar risk to people in a different way. It's a little bit harder to overdose on these medications, but it's a lot worse for people as far as getting their next fix, that addiction property. So an opioid is to heroin as Adderall is to methamphetamine, right? So the illegal drug substance has similar compounds, similar structures, does similar things. They're a stimulant according to the National Institute on Drug Abuse. And these stimulants are used primarily for focus right now. So Johns Hopkins Bloomberg School of Public Health, they wrote an article called Adderall Misuse Rising Among Young Adults, and they found that students are misusing this drug. And this is nothing new. This is something that has been going on since these drugs have been invented back in the 1900s. Basically, people would use these to be able to concentrate better. There's even been documented reports of this used in wartime with fighter pilots. So it has a long history of being used, and what they're trying to do is they think that people on this drug think that they have a better cognition about things. They can think better. So in that spirit of that, they use it for taking tests. They use it for focusing where to bomb where and how to, think better in a crisis and stuff. There has been reports though and studies done that say it does not increase cognition. It increases your thinking, that you are more cognizant. So it increases your ego, basically, which is very interesting. But there's some really serious health risks with this, right? So long exposure can make your liver go bad. They can make your kidneys go bad. A lot of people need their enzymes checked a lot when they're prescribed these kind of medications. And the problem here is that there's no real test for ADHD. The test is to put you on drugs and see if you're better. So this has caused a problem where people have sought out the drugs, even if they think they're normal, even if their doctor thinks they're normal, even if everything might be okay, they just have problems concentrating. That could be a total in on the ADHD medication. So people might be getting this when they don't need it. It creates a bad environment. Back to the college students, a lot of the college students were totally abusing it because they knew they didn't need it, but they had that big test. So they wanted to go ahead and make sure that they could study for their test. That study that I referred to earlier that proved there was no cognitive response for Adderall or Ritalin, they actually even said too that somebody could focus for longer when they're actually using these medications. And so, kind of in closing here, because we're totally prescribing more medicines than usual, and it's leading to things like the opioid crisis and ADHD crises that we're in today, the evidence is clear. America is totally over-medicated. So the next time you're at your doctor, and they prescribe prescriptions right away, they just start writing the script, maybe you should ask if there's other options. Maybe you should do your own research and see if there's any other options for what's ailing you. So I'd like you to think about that next time you're there. Thank you very much.